Wisconsin ranks 41st in the nation when it comes to children's mental health.
Experts say the low ranking is partially because of high rates of depression and low rates of treatment for kids with mental illness. Tonight, CBS 58 investigates. Kristen Barbarisi digs into why it's hard for kids to get help in our state. Kristen.
Bill and Kate, I talked to some parents who've been trying for months, even years, to get treatments that work for their kids. So we investigated why it's such a challenge to get mental health care for children. Pictures of Lisa Tello's 3 kids fill her home, but behind those smiles is a family battling a disease.
At 6 years old was his first inpatient hospitalization.
Tello's 11-year-old son, Owen, suffers from mental illness. He's been hospitalized more than 20 times over the last 5 years.
Suicidal ideation, hurting himself, hurting others.
Tello says she often fears for Owen's safety and for her 2 daughters.
It sounds horrible because it sounds like I think like I'm describing this horrible, beastly being, and he's my child, but he is also, there's this other half of Owen that is this amazing, loving, snuggly boy.
In October, Owen was admitted to Winnebago Mental Health Institute, a state-run facility in Oshkosh that takes kids in need of emergency detention. Things were so bad, Tello and her ex-husband filed a petition with the courts to get Owen long-term treatment.
We feel we're unable to care for Owen and we need help.
A Racine County judge ordered Owen be sent to inpatient treatment, but the county couldn't find a place for him. Some facilities had wait lists, others rejected him.
Some of the facilities will say that his mental health needs are too significant.
So when Winnebago released Owen from an emergency detention at the beginning of November, he was sent home.
I'm not only scared for my daughters and my son, I'm scared for his classmates at school.
It's been 3 months and still there's no spot for Owen.
I love my son a lot, but it's very hard because sometimes I feel like I have to pick between my son and my girls.
CBS 58 Investigates started looking into why there's no place for kids like Owen. Racine County Human Services Director Hope Otto can't discuss specific cases, but says finding inpatient mental health treatment for kids is difficult, and wait lists can range from 2 weeks to 6 months.
The struggle that we have with this is that they are certified by the state and they're privately operated. So because of that, we can't have a guarantee that somebody will be able to be taken into a specific program.
Adding to the problem, the number of facilities available is declining. Otto says 2 closed in 2017, 5 have closed in the last 5 years. That leaves essentially 12 places across the state, a total of 800 beds. Many of those programs taking only specific groups of kids like delinquent boys or kids with developmental delays.
We have to look for alternative services in the community.
Experts say the entire children's mental health system is overwhelmed.
We certainly, across the nation, again, have a shortage of child psychiatrists and psychologists.
A new report from the Wisconsin Office of Children's Mental Health shows the need for mental health services for kids is growing. 1 in 5 kids in the state has a mental health issue. That's over 270,000 children. The need for crisis intervention services increased by 25% between 2011 and 2015. And the number of children between the ages of 5 and 11 admitted to Winnebago Mental Health is up 165% from 2011, the biggest increase for any age group.
It is a challenge, but I think that in Wisconsin, people have been very willing to come and talk at the table.
Kimberly Coronado works with the Office of Children's Mental Health and has 3 kids with mental health needs.
I have a girl who's 14 who's been on since she was 8, waiting for services.
Coronado says a big hurdle for parents is figuring out what kinds of services are offered where they live.
We have 72 counties, and each county does their own thing. There's a lack of communication both from the state to the county and from the county to back up to the state.
The 2017-2018 state budget does provide new funding for children's mental health, including $1.2 million to develop an 8-bed children's crisis facility. There's also millions to help fund other mental health services and preventative care. But none of that is helping families who need mental health care now.
I think the biggest challenge is trying to address things on the front and back end simultaneously. So we need to provide these services today and now, but we also need to find a way to reverse that trend.
Tello says Owen is receiving some at-home therapy while they search for a place, but it's a struggle every day.
I have days where I just don't want to try anymore and I'm tired and I'm angry. And then I have days where I get up and I just look at Owen and I say, you know what, buddy, I'm not giving up, so you can't give up.
Tello tells me she's had to call the police to help with Owen multiple times, and she's concerned when he gets a little older, the police are just going to arrest him and then he's going to end up in the juvenile justice system. So she feels like she's racing against the clock to find him some treatment facility that will take him. Bill?
Kristen, thank you. If you have a story idea or a tip for Kristen and our investigative team, email them, investigates@cbs58.com.